Hi, my name is Dr. Andrew Butler. I'm a board-certified emergency physician, and I'm also the medical director here at America's ER and Urgent Care. I'm here answering your frequently asked questions about COVID-19. Let's jump in. What test or tests should I get? So the big tests that are out there are tests to either, number one, see if you have the virus currently, or number two, they're antibody tests to see if you've had the virus in the past. We do offer both types of testing here at America's ER. The test that looks to see if you have the virus right now is called a PCR test. It's a swab that goes in the back of the throat or in the nose, and then the machine looks at the swab to see if the DNA for COVID-19 is on the swab. It's actually RNA, but you can kind of think of it the same way as DNA. So if you've ever watched Law & Order or one of those true crime series on Netflix, you probably know that doing a DNA test and getting the results back does take a bit of time. So for us, those tests usually take a few days, about 3 or 5 days to come back. And again, you should quarantine while you're waiting for the results. The other test looks for antibodies. So when your body is infected, be it by a virus or other type of infection, your body forms antibodies to fight back against that infection. And the antibody test that we do looks specifically for these defenders. Every infection is different, but what we have found is with COVID-19, it takes at least a week or more for those antibodies to form, even if you have the infection. So because of that week or more time period, the antibody test is not a good way to see if you have the virus right now. Where the antibody test is great is when you're looking to see if an illness that you may have had in the recent past, say weeks or months ago, might have been COVID-19. With regards to antibody testing, many people are asking if having antibodies means that you can't get COVID-19 again. And the answer is, honestly, that we hope so, but we don't know for sure yet. Remember that even though it feels like it's been around forever, COVID-19 has only been around since the beginning of the year. We just don't have enough long-term data yet to really know for sure how long those antibodies are going to stick around. That being said, for many, if not most infections, having antibodies means that we're safe from that infection for a long time afterwards. So we really hope that that'll be the case for COVID-19. One thing you can do if you find out you do have antibodies to COVID-19 is to donate plasma. So plasma is part of your blood. Giving plasma is, for you, exactly the same as donating blood, except that what'll happen afterwards is they will take out the blood cells and what's left is your plasma. The really cool thing is that plasma will still have your antibodies, which they can then give to somebody else who may be sick and in the hospital and trying to fight off the infection, but who may not have formed antibodies of their own. And your antibodies can help that person. It's been shown. If you want to know more, or if you decide you want to donate plasma, then you can go to either the Houston Methodist Hospital website or the Gulf Coast Blood Bank website.